Well, here we are. Good morning, everyone. I am Montgomery County Council President Gabe Albornoz, and it is a privilege to be here in person, live and in color for the first time in 2 years. We are thrilled, and this represents obviously an important milestone and progress moving forward. I want to begin by thanking our Public Information Office team and our IT team who have worked tirelessly to make the necessary updates to these chambers, which took longer than we anticipated. Just as the rest of the world, we experienced some supply chain issues, but we are here and we are very excited to be here. A couple of just quick announcements as Council President. First, I want to welcome Ms. Christine Wellens. This is her first session serving as lead attorney for the Council. We welcome her and thank her for stepping up. And on a sour note, our colleague and friend Councilmember Craig Rice was involved in a car accident this morning. The great news is that Councilmember Rice did not suffer any serious injuries and will be released from the hospital later today. But because of that accident, he will not be able to join us. And so our thoughts are with him and a speedy recovery, and we hope to see him soon. So just a couple of other quick technical announcements. While the system is fully up and running and working well, we still are going to utilize the process by which colleagues notify me if they'd like to speak. So please let me know. Hopefully that entire system will be operational. And please, everyone, be patient. Today is the first day back, and so it's likely there will be kinks in the system. And so we just ask for everyone's patience as we work our way through. But again, we are thrilled to be here today. So with that, we can go ahead and call this session to order. Madam Clerk, do we have any announcements?
Yes, good morning, Mr. President, Mr. Vice President. Good morning, council members. We have a few announcements. The public hearings on the FY23 operating budget will be held on April 19 and April 20, 2022 at 1:30 p.m. and April 19, 2020 and 21, 2022 at 7 p.m. Persons wishing to sign up may do so beginning March 24, 2022. The council is seeking applicants for the vacancy on the Montgomery County Planning Board. The application deadline is March 25th, 2022 at 5 p.m. The council is seeking applicants for the vacancy on the Montgomery County Board of Appeals. The application deadline is April 8th, 2022 at 5 p.m. The council has not received any petitions this morning, Mr. President. That is all.
Thank you very much, Madam Clerk. We will now move on to the Council sitting as the Board of Health, and we will receive updates on COVID-19. And we have representatives from our Public Health team in the Department of Health and Human Services and also Montgomery County Public Schools. We welcome all of you, and it's good to see you all in person as well. So with that, I will turn it over to Dr. Kroll and Dr. Bridgers to walk us through updates from HHS, and then I will turn it over to our colleagues in MCPS as well. And then after both presentations, colleagues, let me know if you have questions. Just text me.
Good morning, Council President Albornoz and members of the Council. First, I would just want to express our prayers and well wishes for Councilmember Rice in his absence, and hope that he is safe and everyone that was involved is safe. What an interesting moment this is in terms of being back in this space as we transition back to our previous ways of working and what will be our next normal, I think. I want to just note that this is something that is with me now, and I wear it in various places depending on the circumstances. I'm sorry, can you not hear me?
It could be a little louder.
Mic's on.
Yeah.
Okay. Can you hear me? Is that better? Okay. A little rusty at this, so it's going to take some time. I think that just the message to the public around this is that we're at a point of transition, and some anxiety around this is natural, and there's some uncertainty in this process. So people wear masks when people need to wear masks if they feel comfortable or uncomfortable, and if it makes you feel comfortable to wear them, do that. I carry mine for the grocery store and for places where I'm not sure about the status of people who are around me in terms of vaccination, and when I'm in crowds. So. This is that moment. It will take some time and some personal responsibility to make and judgment about what works for you. Vaccination is still our best protection for this, and so I'm still encouraging people to get vaccinated. Masks offer a level of security and protection that is still viable and still useful in this moment. So just wanted to make that opening comment to folks. I want to talk a little bit about emergency rental assistance program, a little update on that, and then turn it over to Dr. Bridges for Pulse. Just a quick update that for ERAP 1, we have expended, I think, a total of about $59.5 million to this point. In total, we have expended, I think, $77 million across all of our emergency rental assistance programs for this year. We are finishing up this ERAP 1 round. We have about 400 applicants that have not yet been processed in ERAP 1, and it is we are a little bit overspent. So one of the things that we are doing is using some of the ERAP 2 funding to finish out the ERAP 1. So it'll take a little time for us to finish that up, and then we'll be opening up ERAP 2 at a date that we'll announce at some point in the near future. In terms of evictions, we are still low. We are averaging about between 3 and 4 evictions a week for the last several weeks, and some of those are commercial tenants, et cetera. So it's hard to tell just from that number how many folks are being evicted. We still are actively engaging with folks who are facing eviction to make sure that they are still have an opportunity to avoid eviction and to stay safe and stable in their homes. The ERAP 2 funding is from the federal level is coming to us and is in place for us to begin to sort out how we're going to do ERAP 2 and for use to finish off some of ERAP 1. The state is also, state funding for ERAP is also coming our way. It's still a process of letting the paperwork catch up with the funding, but they're going to give us some additional funding to finish out the first round of ERAP and then to go into phase 2 as well. We do think that we are facing, I think I've alluded to this before, that we are facing what I think will be a challenge for us as we end federal spending, the availability of federal fundings for emergency rental assistance, and drop back to our traditional budget. Those are going to be some challenges that we face because I think the numbers are going to be with us for a while. The need is going to be with us for a while. So we'll keep you up to date on where we stand on this as we open up the second round, and where we are in terms of resources that we see, where we see the shortfall. On the health officer front, I just want to give you all a quick update that we continue to interview and to continue to recruit for our health officer. We have several candidates that are under consideration at this point, and that process is still involving us doing interviews, the county executive doing interviews, the state doing interviews, background checks and such. So while I'm not talking about specific candidates at this juncture, I want to let you know that we are still working on that, and I'm hopeful that we are nearing a conclusion. I will let you know something as soon as I know something definitive about that. I do want to correct a misperception that I think may be in the air about previous candidates that have withdrawn. The sense that I get when I look at the media is that is that we've made an offer to someone and they've declined the offer, and that's not accurate. They have withdrawn at some point in the process, so we've not yet made an offer to someone and they've said no to it. What has happened is that we have interviewed with folks, and at a certain point along the way, they've made a decision to go in a different direction with their career. So we have people who've withdrawn from consideration. So just to clarify and be clear about that. So more on that as we know more. So with that, I'm going to turn it over to Dr. Bridges to talk through updates on COVID-19 and our work on that front. Thank you.
Thank you, Dr. Kroll. Good morning, Council President Albornoz, Council Vice President Glass, and the entire council sitting this morning as a Board of Health. This is a bit surreal for me. The last time I was here, I was sitting in the back supporting Dr. Gales and sending him text messages with updates, etc. Now I'm here providing the updates. So as Dr. Kroll indicated, I just want to remind folks that I truly support our MCPS partners' slogan regarding mask wearing, on or off. It's just me. So you may see me with a mask on, you may not see me with a mask on, but it's just me. So with that in mind, not a lot of updates this morning regarding changes to the metrics. We continue to trend in the right direction based on our modeling. I was sharing, next slide, with Dr. Kroll that based on our initial modeling, we were scheduled to be in a moderate case rate around 41 cases per 100,000. As of this morning, we are at 35 cases per 100,000. We continue to maintain one of the lowest test positivity rates in the state at 1.4 0.44%. We continue to monitor community transmission rates, which I remind the council and the public of those primary indicators such as case rates, test positivity, hospitalization rates, etc. But we've now combined our tracking to CDC's current guidance of community level transmissions, which identify the strain on the healthcare community and hospitalizations. Our community levels are continue to trend in the low to very low range. Our hospital utilization as of yesterday was 1.9%. And as of Monday, we were tracking that we had 29 ICU beds occupied by individuals who tested positive for the coronavirus. In comparison, we talk about the number of cases, and I indicated that as of yesterday, we had one of the lowest number of cases at 25, versus back in January at the height of Omicron, where we had 1,946 cases. So in comparison, we've made significant strides. That's to the great work of the leadership of this county, of our residents, and our resiliency. And so we continue to monitor that. But I must remind all that CDC continues to promote a layered prevention strategy. We continue to test. We continue to test with high volumes, although it has dropped off somewhat. We continue to vaccinate. We know that vaccines work. Now, vaccines don't keep you or prevent us from contracting coronavirus, but it specifically decreases the hospitalization rates, severe illnesses, and most importantly, deaths, as we saw almost 2 years ago. And so we continue to vaccinate. Next slide, please. Next slide. Next slide. Next slide. And so we continue to focus on our boosting capacity. 53% of the county has received, are fully vaccinated, which means that they've received their initial series versus being up to date. CDC recommends that on all their metrics that individuals be up to date, which includes being fully vaccinated and or having up to date includes the booster. And so we continue to focus our efforts on those categories of individuals who still need to be boosted, and we're tracking that at the census level and at the zip code level. Frequent hand washing is always a preventative practice at any public health measure. So continue to wash those hands for 20 seconds or more. More importantly, with all of the vehicles and means that we have in place over the past 2 years, such as testing, such as vaccination, and now more recently rapid test kits that I'm sure Dr. Stoddard is going to give us an update on later on, we recommend that you stay home if you're sick. We have the rapid test capabilities. Rapid tests are in the community, and so we need for individuals to use a rapid test to test themselves, and if they're sick, stay home. The isolation and quarantine guidance is set forth by the Centers for Disease Control and Prevention has not changed since the end of February. 5 days if you're test positive, 5 days with a mask. If you're fully vaccinated or up to date on your vaccination series, you can wear a mask or you should quarantine accordingly according to CDC guidance. But stay home if you're sick. Consult with your primary care physician if you have underlying health conditions, if necessary, such as chronic illnesses or if you are immunocompromised. It's more important now to be vigilant of your health and mindful of your health as we continue to monitor any variants that are out in the community, such as the BA2 variant, which we've seen some cases over the last couple of weeks as far as being reported, not only in the nation, but in the state of Maryland. We had 67 reported last week. We haven't seen the increase, but how do we mitigate those transmissions? How do we stay at a point where we are now with lower transmissions, with moderate levels of transmissions, and with low hospitalization utilization? And then lastly, we are still towards the end and moving towards the end of the flu season. However, we're entering into the allergy season. So cover your mouth. Cover your mouth when you cough or sneeze, use your elbow, but still remember that those droplets, those respiratory droplets are still being transmitted either on surfaces or airborne. So we remind everyone of those public health practices. I'll stop there. I've been asked to keep it brief. You won't get my 20-minute update today, so I will limit it to 5 minutes. Thank you.
Thank you very much. Dr. Stoddard?
Yeah, I just have a couple updates. You'll see an announcement later today, a press release coming out. We're actually going to launch a new testing modality beginning tomorrow. So we're going to have actually at 5 rec centers in Dennis Avenue. You can actually pick up PCR test kits, and there will be drop boxes outside of each of those locations where you can actually self-administer a PCR swab, put it back in the container, put it in the drop box. They'll be picked up every single day, and you're expected to have a result within 24 hours. This is a partnership we have with a local testing company, 2020. It's a Rockville-based company who's actually going to be, they've developed the test kit. It's going to be, you can pick them up just like on a table at the rec centers beginning tomorrow, and you'll be able to drop them off at the same location. It looks like a mailbox outside the location. It's labeled with PCR testing drop-off, and so it's a new modality. The thought process being that as we move through the summer, people are going to still want to have access to testing. We want to make it easier and easier, have closer access to where they are going to be at throughout the normal process throughout the day. But then also people still need those PCR tests for certain travel, plane rides, and things like that. We want to make sure that those are available to them. And obviously, as we move into, we talk about this recovery effort that we're undergoing, part of that is people still believing that they have access to the things they need to be able to manage any sort of exposure that they might have. And so this is part of our ongoing process. This is a pilot. We've got 6 locations. If it works well, it's a new thing for us. If it works well, we'll expand it to additional sites moving forward, but we want to actually be able to see that works. We're moving forward with our Recovery 2.0, as Dr. Kroll has previously outlined. We continue meeting with our work groups that are not just county agencies, but they're partners from across the county to talk about how we manage the long-term impacts of COVID-19, but also how we can learn lessons from the pandemic that we can apply to how we do things better moving forward. And so that's a big effort of what we're going to do. And the first part of that is actually to talk about this MC Smarter plan. It looks very much like the plan that California developed, which is that credible strategy to make sure that we are in a good place to respond to any future surge should that occur. And so to that end, we're actually in the process now of acquiring additional PPE, acquiring additional rapid test kits to have a stockpile to make sure that we have those ready to respond should we see a surge at any point, the summer, fall, next winter, whatever it is. And so I'll stop there, and certainly we can answer questions after MCPS.
Thank you, Dr. Stoddard. To our colleagues at MCPS, floor is yours.
Hi, I'm Jeannie Dawson, Chief of Finance and Operations. We're pleasantly pleased to be here today in person. Let's have the next slide, please. So we're here to give you updates on multiple factors. So first, looking at the daily rates that we have for cases, you can see that they have gone down in general with a few spikes. The spikes tend to be around weekends or multiple days added in at one time. But we are happy that we are moving on a downward trend, and we work diligently with our DHHS partners. Next slide, please. So in terms of masking, the Board of Education on March 8th did move to optional masks for all staff and students throughout all buildings in MCPS. We have started a campaign on or off. It's just me. And the idea is for us to be kind to one another and to also be respectful. In addition, that is to help the emotional aspect of students and staff because, as you know, people feel differently about this, and we want to respect that. The other aspect that we have is we remain vigilant to our isolation and quarantine periods. As you've heard earlier, we are maintaining mask wearing past day 5. So when students or staff return from a quarantine or isolation, they are to wear their mask for 5 more days in addition. Next slide, please. In terms of spring break, we also know that as masks are optional, we are not in any way changing our mitigation strategies of testing. We test daily, and we also, that's asymptomatic testing with our vendors of Scion and Gene 2020. We continue that. We also have continued distributions of eye health kits. So this is our 3rd distribution coming up, and we've been doing it every 3 weeks. In this, preparing for spring break, the idea is for us to deliver these to schools, and then for schools to then deliver them to families and students, and that will occur between March 25th and April 6th. So people have plenty of time before spring break to get their eye health kit. We also are requesting all families to test on Monday, April 18th, the last day of spring break, so that they can see if they have, contracted the virus or are positive. If so, stay home. And they are to report positive cases to us through a portal that we use currently. And we, will continue to, even after that, have the eye health kits on hand for people that are symptomatic or those that need kits. We do have some to continue with. In addition, I do want to highlight that we will always keep masks. We have KN95 masks. We have plenty of, hand sanitizer, soap, all of that. We're keeping all of that in good condition, and we're not going to let up on providing those things for students and staff. Next slide, please. I will turn this over to Stephanie Izzard to talk about vaccinations.
Good morning. It's great to be here in public with all in the setting together, seeing you outside of that little box. I do want to continue to share with you that vaccinations are continuing in the district with that equity lens that we approach from the beginning and onset of our vaccinations after school and on the weekends. Now, we did ramp up support especially for the hesitant group, so we partner with MCCPTA as well as the Parent Council to ensure that we're reaching those groups that still have questions. And so our MCCPTA partners have done an incredible job with creating the Facts Plus sheets and reaching out to communities, doing some door knocking and reaching out to those groups who are still on that bubble. And we're seeing them slowly but surely coming into our clinics. We combined the vaccination clinics with also some health information. And so if some of you did attend one of our clinics where we combined that at Blair High School, Magruder, and at East Silver Spring, where we had also other health initiatives occurring at the same time, we will continue with that. Now this weekend we're calling, because I love a good acronym as a former teacher, it's our Booster Before Break clinics that will be held this Saturday. So we're asking those who need that booster, but we also will have all the other full menus available too, to show up at Banneker this weekend and several other sites, Gaithersburg Middle School, Neillsville. If you go to our website, you will see the list and the links on where you can register for your boosters or first or second doses.
Well, thank you very much for those updates. Colleagues, just text me if you'd like to speak. I have a couple of contextual questions. There was some news reported that the federal Department of Health and Human Services had expired their COVID-19 budget, and this has become a political football at the national level. Do we have any acknowledgement or knowledge that this could become an issue for us or local jurisdictions? Is there any concern with that conversation as it goes on at the national level?
So I'm not aware that there's any concern for us yet at this point, but we will obviously keep looking at that. I don't know that there is a great deal of impact in the short run. There may be some impacts at the state initially, and then we trickle down to us. But I know, Dr. Stoddard, you may have some other information on this.
No, I think most of the federal funding has already been allocated to the counties for the most part. Now, obviously, with regard to how we rely on the federal government, it's often on reimbursement on the back end, which is an ongoing process and usually occurs, weeks, if not months after the expenditure has been made. And so obviously that will be something we'll follow and track. But actually, most of the reimbursement comes through the Federal Emergency Management Agency, not DHHS at the federal level. So I would not expect to have any implications for our readiness or response in the short term.
And as a follow-up, that's great news regarding the home PCR tests. Just again, for context, what's the turnaround time on those tests, and what's the capacity? Because we want to make sure. And are we encouraging people to secure those tests if they're showing symptoms, or are we encouraging them to proactively secure those tests in case they have somebody in their home who may be especially vulnerable?
We'll certainly have them available so if people want to pick them up for any reason. I mean, obviously, if you're symptomatic, I would not encourage you to go to one of our rec centers. I would encourage you to send someone to pick up a kit for you in that case, and then you can swab, and then they can return the sample to the box. We've ordered enough where, I think we've ordered a few thousand of these, so we'll test it out. But I don't think people need to hoard them in their house. They're going to be readily available to the public. We want to make sure that people have access to them, and so we would not encourage people to grab them and take them home. But if they need it, or they feel they need it, they've been exposed, maybe they're traveling. If they have any reason to test themselves, they're certainly welcome to. Any reason they would have gotten a PCR test otherwise, they can go and seek one of these kits out and utilize them.
And Council President Albernosi, we were advised by the vendor that the turnaround time is 48 hours. But more importantly, with the new kiosk, it will help alleviate, as we de-escalate our operations, testing at our current sites in the county. So it will be a complement to those testing spaces. So we will now have a kiosk and those physical spaces to get PCR tests.
And then lastly, I would say that it's also an adjunct and a complement to rapid tests, to take-home tests, so that people can continue to access and use, and would certainly recommend that they continue to do that. The PCR may be, if there's a special need, if you tested positive and you want to get a PCR to follow it up, or you've got to travel, as I think Dr. Stoddard alluded to.
Dr. Bridges brought up a really good point. We want to make sure that we're, for example, the East County Rec Center has been a host site for PCR testing for a long time. We want to have it be a rec center as well, and so we're going to little preview, one of the pickup sites will be the East County Rec site, so we can actually return that space to recreations for utilization for our critical recreation services as well.
Great. I have colleagues who are in the queue to speak. I have Council Vice President Glass, followed by Councilmember Reamer, and then Councilmember Hucker. We're doing okay on time, colleagues, so we don't need to institute the 5-minute rule right now. So with that, I'll turn it over to Council Vice President Glass.
Thank you, Mr. President. Good morning, everybody. It is nice to see all of you. Nice to see my colleagues as well. I'm glad we're here today, that our collective efforts over the last 2 years has gotten us to this place. It wasn't easy. We got through it. We're continuing to be vigilant, and that's why we're having this conversation today. And so to pick up on the last point that Dr. Stoddard, you were just referring to, talking about East County in particular, I appreciate the public acknowledgement of the importance of the rec centers. Clearly, a number of our public facilities, the East County Rec Center has been transformed into this healthcare facility of sorts. We also have other rec centers that have been utilized over the last 2 years for homeless prevention efforts, and with the opening of the Neville Street shelter, those also will be returned back to the community, and appreciate everybody's collective efforts on that. But with regard to the county's efforts to provide the testing and vaccination resources, I'm not sure I saw it or heard it on the presentation, but what is the public engagement, the utilization rate of our various facilities? How has that waxed or waned in the last few weeks?
We've seen a pretty substantial increase in the people willingness to participate. We're not back to pre-COVID levels, and it's probably going to take some time to get there, but we have certainly seen interest in recreations programming. We're obviously bringing back in our library system all of those reading opportunities and group events. I just was reached out to about bringing toys back into the Noyce Library, things like that. Those are all things that we are doing, and so we're expecting that, it's, as I think Dr. Kroll alluded to in the beginning of his comments before, it's going to take some time for people to get comfortable with the idea of coming back out and enjoying some of the amenities that Montgomery County makes available. I shouldn't say amenities, the resources and real services that we offer through our recreation libraries and other settings. But we are seeing an uptick, and we've seen a constant uptick as people become more comfortable. And I think that's an important thing, and that's why we are so supportive of people. If they want to choose to continue to wear a mask in those settings, that we encourage it. They certainly can. If they don't want to, they don't have to either. But obviously getting out and being part of the community, again, is a big part of that mental health recovery, and those services are a key to making sure that people have that opportunity.
I appreciate that. And so clearly people are coming back to utilize government services, libraries, rec centers, but for our programs or our locations where we still provide testing, what is the utilization of those testing services?
So, Council Vice President Glass, we continue to see a decrease in individuals coming out, not only to get tested, but to get vaccinated, but it's a steady flow, if you will. I have on the monitor where we are as of the end of February, beginning of March. And so we continue to have those systems, those spaces operational as part of our de-escalation plans. So part of that planning also includes the individuals, the staffing that we have, the clinical staffing as well. But we still see a utility in the community. Folks are still coming out. And as the season changes, a little warmer now, folks are still coming out to get tested. They're also coming to get vaccinated in those spaces in Up County and our Silver Spring Civic Center, and our Dennis Avenue is a frequent flyer space, if you will. And so there's still community resources that are needed in the community as we continue to monitor not only the variants, but it's still of use, if that answers your question.
Yeah,
Yes.
that is the question. And so the combination of what you just shared and what Dr. Stoddard shared, what is the long-term strategy to recognize the slowly decreasing utilization of vaccination services and testing services and the increased need to get back into recreation, libraries, others, but recognizing people are still concerned, rightfully so?
So Dr. Crowley, I'm smiling because we talked about the next normal, not the new normal, but the next normal. And so we put together a next normal framework draft that we're working on. And the acronym that we're using is SHOTS, SHOTS, and operations and the S's. And I'll just go through just the acronym just to kind of give you a higher level overarching thought. So the S is for SHOTS, looking at our vaccination clinics and the operational aspects of those clinics and the utility and the current vaccine operations and the transition of those operations and those potential surge operations. And so as we continue to navigate through this draft plan, we have the H, health monitoring, the surveillance and disease investigation, looking at those outbreaks, those child care schools that Councilmember Friedson always asks me about, and the guidance regarding that and our public school partners, but also our community cases, and then also managing the epidemiology of it, the disease control, and looking at those outbreaks in those assisted living facilities, those long-term care facilities, those high-risk facilities that are congregate spaces, and then looking at those data systems as we continue to monitor the case rates that our website will be updated to not only have the previous metrics or the past metrics or the current metrics, if you will, but the community level metrics as more recently defined by CDC. And then we look at the outreach and awareness, the communication, the getting us all on the same page to make sure that all the communities are aware of what we're doing and to make it clear and understandable and culturally relevant, the hours of operation, what those time frames will be, including the holidays. And then we look at the testing, the PCR and the at-home rapid tests, the kiosk, the locations, our minority health partners, our Proyecto Salud and our Mary Centers and our Caseman clinics and our Ready Care and our CCACC, just to name a few. And then we look at those hours of operation and then the at-home rapid test distribution. This is a working document. It hasn't been shared, but we have put thought into this. And then staying ready is the S of the SHOTS. Staffing and volunteer retention. You know, we use the Medical Reserve Corps at the height of our COVID response. But how do we employ that asset, that capability as we recover? And so all of these acronym items, these items are being taken into consideration with our consultant staff, our Athena, our Maxims, our Medical Reserve Corps, and then our county staff, those support mechanisms that we had in place through all of the surges, the 5 surges, as well as we de-escalate those services. So that's pretty much the plan for the next normal.
This is the first time I'm sorry.
I just want to add a couple of things to that. Just one of them, and I think Dr. Bridges has outlined where we've been our thinking in our conversations nicely. It functionally means in some cases that we're decreasing staffing because of the volume. We don't necessarily need the volume of staff that we've had to deal with the demand that's coming through our doors now. It also means that we are taking advantage of, as Dr. Stoddard mentioned, the PCR drop boxes as an alternative way of getting folks tested as they need it, and rapid testing. For vaccination, I think it's about targeting areas of the community where there has been clearly a lower or slower rate of uptake for the vaccine to make sure that we are reaching those areas and still making it available to those communities, as well as prepping for the 2 to 5 year old vaccination effort that is sure to come at some point from CDC and the FDA. And of course, I think Dr. Bridges talks about the importance of prepping for the future. Potentially fall and another flu season and potentially another outbreak, and both monitoring the presence of COVID in the community to make sure that we are at safe levels or at acceptable levels, and monitoring the variants in the county across the country and what's happening in the county around variants. So those are, I think, we will be doing as we go forward in the future.
I very much appreciate that detailed response. It's the first time I've heard the term next normal. So that's good. And I think it's a deep recognition of what people in our community are looking for. That we have done the best we can over the last 2 years working with the data and the science that was quickly moving. And here we are in the new normal, already looking towards the next normal, and the plan that you've highlighted so that people can look towards and that we can gauge against, I think is a sound approach. And I appreciate the thoughtfulness in which you've put into it and shared it with us today, and look forward to moving towards that next normal with all of you. So thank you. Thank you, Mr. President.
Thank you. We've got next Councilmember Reamer, followed by Councilmember Hucker, and then Councilmember Navarro. Councilmember Reamer.
All right. Thanks for the presentations today. It's great to be with you. Very interested in your progress on the 2020 partnership for the self-administered PCR test. That's great work. I did hear 2 different turnaround times. What is the turnaround time that a person can expect once they've dropped off? Can you walk through that again?
Part of the reason why it's a pilot is we're about to find this out. The company actually believes they can do it in 24 hours. They actually initially wanted to say less than 24 hours, but I think we've cautioned them to be more realistic, to say 24 to 48 hours is probably a good place to start. And then we'll know results as soon as we start picking up samples, and we'll be able to report those back on how quickly. They're going to be picked up once a day, typically, I think, before the libraries close in the evening, and they'll be tested overnight typically, and usually have results the next day based on the volume they're facing now. But obviously, depending on that volume and how many samples they get, because obviously they're partnering with the schools and others, it will determine whether it's the same day the next day turnaround or the day after.
We think that the public should assume a 48-hour turnaround in terms
For
of
now,
planning
at
and
least,
thinking about
until
themselves, just to give themselves a little window of time.
Yeah, if you need it for travel, obviously you don't want to you want to make sure you have enough buffer in there to make sure you get it. So a 2-day turnaround, I would expect in most cases at this point it's probably sooner, but you should plan for it to be 2 days.
Well, as you build the experience with it, and you'll be able to communicate what the actual turnaround is, and if it's improved from 48 hours, then we'll be able to share that. We are now in a time when people want rapid turnaround on their tests, and we have rapid antigen tests, and it's really important. Actually, I had a COVID scare in my house, and I took a rapid PCR test yesterday about 5 o'clock, and I got my results about 5 in the morning, and that's why I'm here today. But people expect to be able to do that, and they need to be able to do that if possible. So 24 hours is a big difference from 48 hours in terms of your return to work or return to school. So in any event, as we proceed communicating about that, I think it's exciting that you could have a self-administered 24-hour turnaround test. If we can get to that point, that'd be great. So we'll look to hear more about it. Could you share some perspective on what you're seeing with the news of some resurgence in Europe? How severe is that? What are you thinking about timelines and possibilities here?
Sure. Thank you, Councilmember Reamer, for that question. So we've been monitoring the BA2 surge in some of those spaces in Europe, more often than not based on the data that we're reading and the metrics that we're seeing. In some of those spaces, folks have lowered their guard, if you will. And so in many cases, based on the narratives that I've been reading, folks have gotten away from those public health preventative measures. In spaces, according to the CDC, where they know that there are low, moderate, or high levels, then CDC clearly defines when you should and should not wear a mask, or what you should do as far as your vaccination status. We haven't seen the BA2 increase. It's still a variant of concern based on the World Health Organization and the CDC, but we are monitoring it at the national level, the international level, and the state level. And so I've been providing an update and will continue to provide an update to the Board of Health. But let's not get away from those preventative measures that we prided ourselves and we've been resilient on the last 2 years. I mentioned some of them during the opening comments. Testing, it's always a measure. You just mentioned it regarding the kiosk and the turnaround rates. And just to add to that, folks should be reminded that when there are increases in cases, that the turnaround rate may be a bit delayed because the labs are experiencing the stress as well as we've seen in Omicron. But we continue to vaccinate. Vaccinations work. We are one of the highest vaccinated counties in the nation, and we continue to push for vaccinations. And so in some of those spaces, this is how we continue to mitigate and suppress any increases. But it is on the horizon, and we are watching it, and we are vigilant and mindful of that, and we will apprise council accordingly.
All right, thank you.
Thank you. Councilmember Hucker, followed by Councilmember Navarro, and then Councilmember Friedson.
Thank you, Mr. President. Great to see everybody in person. Welcome back. A couple quick questions for MCPS. So what has been the feedback since the mask requirement was removed, and has it differed for students, what you're hearing from students, what you're hearing from teachers and other staff?
It's a great question. Thank you. We're hearing actually some positive aspects from students and staff, because some students are continuing to wear those in schools, and staff too. We also believe that the way that we've rolled out the campaign to be okay to wear the mask, that's really been helpful, as has staff in buildings encouraging respect and the emotional components. And we have our staff throughout the district monitoring in schools. So it's been a positive and embraced option. Of course, there are people that are not comfortable with it, but they continue to wear masks, and we continue to stress the fact that we have the mitigation strategies that we do as we move forward. And we've also been working with our COVID advisory committee that meets weekly, and that's consistent of epidemiologists and the parent MCC PTA, and we have wonderful partners in that, as well as staff members. And it's a great diverse group to get multiple perspectives of how we embrace this new change.
Great. Please, sure.
I visit a great deal of schools, and so just from my observation and my talking to staff and in schools, I noticed, especially the first couple of days, that the older the student was, especially in elementary, the mask either came off or was halfway down, but you could see they had adjusted as far as this onset as now. But I did notice that it looked at the beginning 40 to 60%, and that's just my visual from several schools I've been in, that the majority of kids I did see did have their mask on. And the ones I saw as they got a little bit older in elementary, I saw the mask come down or halfway down. I don't have any other data besides that visual, and I did see that respecting that individual choice was maintained in the schools. So that was positive.
Right, that's very good to hear. Have you received reports of any bullying of students, either for wearing a mask or for not wearing a mask?
Not yet.
Okay, great.
Yeah.
Not yet in our office either, but our office, Student, Family, and Engagement, we will respond, especially with our restorative justice team, if that does occur. So we are doing our due diligence to monitor if that does occur.
And has the feedback that you've received about the mask requirement, the ending of it, varied by school or by cluster at all?
I can't speak to that exactly. I would say that we're hearing different things from principals where I know it's not cluster, it's more school-based. So different schools, more kids are wearing them. Some may not be wearing as much, maybe a different percentage of the population, but we're not hearing it by cluster.
Right. Well, is there greater adoption of mask wearing in schools that have lower vaccination rates, or is there any correlation?
I can't say there's a correlation at this point, but this has only been a week, so we're still exploring that with our principals and staff.
Yeah, if you could keep us posted, that would be great.
Absolutely.
Could you elaborate a little bit on the latest efforts to support students dealing with mental health challenges?
We actually had, before coming here this morning, I sat with HHS and MCPS as we prepare for March 17th as a group, but we are working together with our partners because we know this is an elevated topic, and not just a topic, it's where we are right now with our students. So between that collaboration and elevating the supports we already have in place, we hope to, as we process this with you on the 17th, to be able to bring those supports into fruition for our students. So that is also a part of this conversation. It's not just the somatic and non-somatic, it's that whole wraparound services to ensure our students are healthy and ready to learn, whether it's physical or mental.
Right. Can you elaborate anything on what you're doing to prepare and to deal with this? I mean, because you're right, it's not just a topic; it's a crisis at this point.
Absolutely. Part of my job, again, because I don't want to speak out of turn, that's our mental health clinicians, our psychologists, and so forth. So you'll hear that more elaborated from there. But I was just as a process observer in the room, seeing how those dots are being connected by both agencies to ensure that those supports are in place, whether it's through those hiring of those social workers, those new therapists in the targeted schools that were recommended based upon those high incident rates. Those are all part of those conversations. To go into detail, I would be remiss because, I was process observing on how they're connecting those dots.
Sure. Out of the funding we provided for 50 social workers, do you know how many have been hired?
The last report I received, I think there were 22.
22?
22. I could be wrong because, again, I'm process observing. I think it's along that line.
Yes, I believe that's accurate.
Okay, that's up considerably. Okay. When will MCPS have moved toward all schools having a mindfulness or wellness room for students that are need a safe place to de-escalate?
That's part of our current budget. And really working with schools to incorporate that. So over the next several months to really build that in and build that into next year. That's a definite goal for us to expand that because of the wellness for our students. So yes, that is a goal for this year.
Right. Okay. There will be a lot more time over the summer, but do you have any sense of how many schools or percentage of schools that will have such a room by April or by May?
Of this year, I believe we have over 100, and it's definitely over 100 currently. Yes.
Okay.
But in the next several months, we'll add as many as we can. I think that's something that's really over the next several months and year to get into 200. Will be 210 schools for next year.
Right. Okay. Thank you very much. Thank you, Mr. President.
Thank you. Councilmember Navarro, followed by Councilmember Friedson.
Thank you, Mr. President. What an occasion this is. I think that we should not overlook or sugarcoat the fact that it has taken such an extraordinary strength of leadership to get us to this day. I am a big believer in not just jumping into just the next thing, but reflecting on what it has taken to bring us to this moment. So I do want to honor that. This definitely has not been easy. There are many people who are not with us, especially folks within county government who are out there providing the most extraordinary help during such a difficult time. And, I keep thinking about that first time that I went grocery shopping for the family. It was almost like, a movie where you go, I volunteer and let me put on everything and go out into the, wilderness to figure out what's going on. I mean, it seems kind of humorous, but it was real, and it's been real, and it's just been extraordinary. That here we thought it was only going to be a couple of months, but no, 2 years in. So I just want to truly express my appreciation to this collective leadership for having the courage, the willingness, and the compassion to step up time and time again with no guidance at all to get us to this point. I think it's very important to honor that moment.
And so just a couple of things. I mean, I appreciate a lot of the questions. I of course, read like everybody else some of the news reports, and just saw that I think China has gone into another major lockdown, 51 million people. So of course, here we are trying to figure that out. What does that mean for us? And I appreciate, Dr. Bridgers, you're talking about you're monitoring the situation in Europe, but no doubt we have to figure out what's going on there as well. And then the conversation around how we're going to utilize our facilities, our rec centers, our libraries, et cetera, and then going back to the conversation about mental health. And how can we almost, weave into this next normal, so I'm talking about things such as programming for our recreation department. Could we be strategic in augmenting mindfulness programs, right? Whether, I don't know, yoga, meditation, or just safe spaces, et cetera. Is there a way for us to very strategically, really, truly embed this everywhere? Because it's not just the school system, and we're going to be discussing, the proposal for the expansion of wellness centers in all the high schools, which is very important. And I appreciate so much this collaboration to get us to this point. But we also have so many other points of interaction. And I think that, yes, we've been in crisis mode. We've utilized our facilities and for testing and for vaccination, et cetera. But now it's kind of like this, okay, now what? And could we really, truly, in a very innovative way, just wherever we can, embed those kinds of opportunities to offer folks this kind of reset and, just nourish back again the emotional health, et cetera. Is that part of because I see Dr. Kroll kind of smiling. Is that part of the conversation that is happening? And when can we hear this proposal? Because I just, it's just something that I really, everywhere I go, I seem to just run into that sort of need, right? Everybody's expressing this in different ways, in different communities. It's expressed differently, but the bottom line is that people are hungry for some type of support in that space.
Councilmember Navarro, I'm smiling because you're A, you're in my wheelhouse, and B, you're singing my song. So both of those things are important. I on record as having said that therapy isn't the only thing that is therapeutic. Mm-hmm. And in this moment, I think that all of those things that promote our health and well-being serve that. When we look at seniors and the senior work of the senior communities, their outreach, their engagement, their connectivity to each other, all help support mental health and well-being, and will all play a part in the recovery process that we're on, path that we're on. When I talk about Recovery 2.0, one of the things that we're looking at within the department is how do we push that mental health service out, both in terms of the direct clinical service, but also in terms of the other things that people can do. I've had conversations with my counterparts in both library and in rec about the possibility of doing some work in those spaces and partnering with them to do some of that work to bring that kind of therapeutic service and support to the community in a variety of different places. So yes, that is part of how we're thinking about it. As that plan unfolds, we will certainly share that and seek some input from you all on strategies. I think what you're seeing in the MCPS space around meditation spaces and quiet rooms is longstanding good evidence-based practice, but now time to adopt it. And I will say this, that mental health, there's a sense of urgency around this now in this moment. This mental health need is not new. It has been with us for a long time, and it's been urgent for a long time. It is just very visible to us now, and it is coming to us in a lot of different directions. People are stressed and anxious, and our goal now is to try to make sure that doesn't turn into a major mental health problem for people where we can, and to bring folks back from the edge who've already gotten there. So we've got dual tasks in front of us. One is addressing the urgency, and the other one is building a system for the future that does more to promote wellness and healthy and mental health and wellness in the community. So that is both the short and long-term window that I see open for us now as part of our recovery effort.
And in the same vein, we talk about mental health, but also things like learning loss are not just an MCPS issue. So we've talked about with rec centers and libraries also utilizing those spaces to support or aid addressing the learning loss and socialization loss in children, for example. We've talked about our food service providers being a conduit for releasing mental health information or access to services. there's been a lot of negatives with this pandemic, but there's also been some tremendous partnerships that have been fostered and built through the pandemic that we can now leverage to address the needs of the pandemic, but also, as Dr. Kroll alluded to, address needs that were there the entire time. But now we've got some new and innovative systems that we did not have before the pandemic that we can utilize to leverage to improve access to services, information, multicultural information. And so I think, that's part of this whole Recovery 2.0 process, is to try and really not just address the consequences of the pandemic, but really to try and leverage the gains that we've made in certain areas, and particularly in many of our more diverse communities, and leverage that for the future. We've had tremendous success in vaccinating our various populations in Montgomery County, and we want to be able to build on that success for other things like mental health and learning loss, or just access to service generally.
Dr. Stoddard reminds me to add one thing to this, and that is that everything that we're talking about the community having been through for the last 2 years, the staff and faculty and each and every person in this room has been through that. And as we start to figure out how we manage to serve the community, we also have to take some time to create some space for our staff to heal and to recover from this as well. So,
Thank you. I just keep thinking about how we as government are always so, good at really addressing those very important, urgent, basic issues, whether it's learning loss or whether it's the issue of vaccination, et cetera. I think we can also play that role in this notion of wellness and mindfulness, right? Like so many articles recently coming out about the role that, pets have played in people's emotional, health. I'll confess, my youngest daughter, after I lured my 2 adult young daughters back during the pandemic, the youngest one wanted to get her pet. She's like, okay, then I'm going to get a dog. I'm like, sure, no problem. He was only 10 weeks old. Well, she moved out to the West Coast and took him. And she sends me this photo, and I'm literally looking at it. I'm like, oh my God. And my husband's like, what's wrong? Are you okay? What happened? My other daughter's like, I miss him so much. And they're like, oh my God, what is wrong with you? And then my youngest daughter's like, well, you don't miss me? What do you mean? You miss Rafa instead? But my point is that you underestimate the impact of something like that type of companion. So I think that, as we move forward with some of these activities and this programming, there are so many opportunities to strengthen, whether it's music, whether it's art, whether it's, even pet therapy. They're using that in so many other ways, because I know that it's very difficult, right, to just hire like licensed social workers, licensed psychologists for everyone. Perhaps there are these other opportunities in our parks, in our recreation department, in our libraries, et cetera, to be a little bit more intentional around offering those kind of opportunities as a release for our community members. I think that could also be a complement to everything else that we are doing at this point. So anyway, thank you very much. I definitely look forward to, as we work through the budget. I was on the phone hearing the budget release, figuring out how we can align a lot of that type of investment with, some of these needs that we know exist out there. Thank you.
Thank you, Councilmember Navarro. The one downside to being in person today for me personally is Coco's not at my feet, my rescue dog, which I really love. Councilmember Friedson.
We appreciate that as well. I think as we were transitioning now to in person, there was a lot of appreciation amongst the public, but the interesting dynamics over the last couple of years of special appearances, I will call them, and interesting noises that we have seen over the last couple of years during our meetings. We've taken some of the surprises out of these conversations, but I'm happy to be back here. Appreciate the fact that we're in person doing this work, and I'm excited for the next normal, as we just learned. First time I've heard that term as well, and think it is a good term. And I think we're going from shots literally to shots as an acronym, I suppose, which is an interesting transition. So I guess it's the next shots to the next shots. But really excited to hear specifically about the PCR test capacity. I think that's really interesting. A couple things. One, I wanted to clarify. I just want to make sure I'm understanding this and the public is understanding this. A 24-hour turnaround, 24 to 48-hour turnaround, because we want to undersell and over-deliver, come in under our budgeted time, and set expectations appropriately, which I think is prudent. But that is from the time that the facility picks it up. So if you're a resident and you drop it off in the morning at a rec site, the facility then picks it up in the evening. It's 24 hours from the evening, so that would be 36
I think they're actually
hours
running
potentially.
most of them overnight as is. So if you dropped it off, let's say on a Tuesday, they would pick it up Tuesday. Well, if you, let's say you pick it up, you drop it off before they pick it up, which is right when the library closes. So if you drop it off like overnight, then it gets a little messed up. If you drop it off before the day, they're gonna pick it up at the end of the day. Libraries close at 7, I think, most cases, or around then. They'll pick it up around 6:30 or so. They'll either run the sample that night or they'll run it the following night. So if you dropped it off, let's say at 10 o'clock in the morning, they picked it up at 6, you'll have it typically like 5 a.m. a day and a half later, really. So really to get to the 48-hour mark, they have to have really had some delays in there. And so just given that they're running most samples overnight and they're picking it up at the end of each library day. So depending on when you're dropping it off, that's when it will vary.
Okay, that's great. Well, I'm glad I clarified. That's even better than I had thought. You'd mentioned a few thousand. A few thousand doesn't seem like a lot to me.
This is a pilot, and so we want
Yeah.
to make sure, obviously they've had to produce packaging and make the kits to make sure the kits work the way that they're supposed to work, make sure that the samples get picked up in a timely fashion, make sure that they're returned properly. And so we're modeling this off. DC's been doing this for a while, so they have had drop boxes at their libraries. And we just want to, this first time we're doing it, we've ordered a few thousand. They're not hard to produce. The lab produced them fairly quickly. They printed the materials and created the packages. So we're going to use the first maybe 2 weeks to assess. I mean, we haven't had multiple thousands of tests that Dr. Bridges can confirm in our PCR labs for the last few weeks. And so, obviously I think we'll be able to have at least several weeks worth of them ordered, test them, make sure that they work. And then as soon as we figure out that they work, then we can increase the order moving forward. It's a pilot for that reason, because we want to make sure that we have correctly built the system before we invest a huge amount of resources in it.
And when will they be available and where? You mentioned one site, White Oak, I heard, but when
Not
and where
White
will
Oak,
they be
is
available?
East County. So we'll have a press release there.
Or
saying
East
that-
County, excuse me, I'm sorry.
There'll be 6 sites, Wheaton, Plumgar, East County, Bauer Drive, North Potomac, and then Dennis Avenue Health Center will be the 6 sites. So we'll have that as a release to explain the whole process, what it'll look like. They're going to be kits that are essentially on a table that you'll go to that rec center, pick them up, take them home, or take them to your car, swab yourself, put the package the way it is, and you put it in. You have to do an online correlate. So like there's a portal where you have to enter information in so that you can get your information, get results back. But it's a pretty simple process and mirrors exactly what DC does. Actually, if you're on our PCR testing website now, you will see that the module to actually do this went live, I believe, last night at 11 o'clock. And so it's already, the portal itself is already up and running to operate. And it'll be pretty straightforward. The press release will explain the details of exactly how you access it.
And the press release will come out today, and then when do we think they'll
Tomorrow.
actually be, or tomorrow, excuse me, and then when do we think they'll be
The
available?
press release will come out today. They'll
And they'll be
tomorrow.
available tomorrow.
Correct.
Yeah, you're already answering my next question before I even had a chance to
Yeah,
ask
sir.
it, which is great. No, I appreciate that. Well, that's exciting. That's great. And we think we'll have the capacity. This is just a pilot of a few thousand. That will probably go pretty quickly. And then once we work out any kinks, there's capacity
If you go
of
many
this.
more sites, more, certainly I think we would like to do that. Yeah.
Fantastic. Okay, well, excited to see the release. Excited to watch residents take advantage of this and to see how this works in the first few days of the pilot, and then to expand it from there. And I guess the next normal begins now. And really appreciate everybody's efforts, both in the school system and in county government. We certainly have a lot of work to do. I hope that the next normal includes this culture of yes that we've been able to figure out at times in the middle of a crisis. And I'm hoping that when the crisis dies down and as we move into the calm of this next normal, that same sense of urgency that we've had in county government that hasn't always existed, and that same willingness to try things that haven't been tried before continues. And I think that's true in Health and Human Services. That's true certainly in MCPS, and I think that's true across county government. And so here's to that culture of yes, and here's to the sense of urgency, because we certainly have a lot of issues that we're going to have to continue to deal with. They weren't new in COVID. They got a lot worse during COVID, and they're going to continue to linger as we move forward from COVID, and we're going to all have to work together in order to address them comprehensively. So thank you very much.
Thank you, colleagues, for all of your comments and questions. And obviously things are improving, as Councilmember Navarro noted. Just it really is significant and profound and hard to process when you think about the road we've taken over the last 2 years, and it is really important, and we must remain vigilant, as has been noted. So thank you all very much. With that, our session sitting as the Board of Health is now over, and we can move on to legislative session, day number 8. We're running a few minutes early, and so do we have representatives here from the executive branch? And I see Mr. Drummer is here as well to help us continue through this process. While Mr. Stoddard and Mr. Drummer are getting set up, let me just remind everybody that this continues the dialogue and discussion regarding the expedited bill 4921, Police Accountability Board. We have in the audience representatives who have participated in the process thus far at the dais today. We have representatives from the executive branch and council office. So we are going to continue this discussion, and as is always the case, people are available to answer questions when called upon. But we have made great progress in the development and discussion of this critically important bill, and we are on track to pass this bill out of the council by the end of March, as we had noted, to give the executive branch the opportunity to begin executing this critically important bill as soon as possible to both recruit the members that will serve on the PAB as well as the ACC, and then train them as is required currently. And so I want to ask Mr. Drummer to walk us through the packet and where we are currently right now. Mr. Drummer, please.
Okay, good morning. Welcome back.
Actually, if we could wait a moment, looks like a couple of colleagues are not at the dais, so let's just give it a couple of minutes.
Bob, you might want to get closer to the microphone. Okay. Hurry up and wait.
We don't have a quorum, actually. So, yeah. Yeah, yeah. Well, we're taking an organic break here. Why don't we start right at 11 then? So just bear with us, and we'll get started at 11. All right, I've got 11 o'clock, so thank you, colleagues. We will now again continue with item number 4, which is legislative session, day number 8, work session regarding expedited bill 4921. Again, for context, this bill we want to ensure is enacted before the end of this month to give the executive branch the opportunity to recruit, on board, and then have the council approve members of the Police Accountability Board, who will then be tasked with appointing members of the ACC. And there is, of course, training components required as well. There are several outstanding items left for us to have a discussion. We'll see how many of those, if we can get through today, and maybe we may be able to get through all of them. But we will not be voting on this bill today. But this, obviously continues the work sessions, but with the goal of getting this done before the end of this month. So with that, Mr. Drummer, I'll turn it over to you to walk us through the packet and what items remain outstanding.
Okay, good morning again. The items that have already been decided is the PAB membership would be 9 voting members with at least 1 member residing in a municipality covered by the Police Accountability Board, and also permit the executive to appoint 1 or more non-voting members. The amendment has also been approved to clarify that all complaints from the public of police misconduct must be investigated by the appropriate law enforcement agency and reported to the Administrative Charging Committee. And there was also an amendment to require funding for training of the Police Accountability Board and the Administrative Charging Committee members from both the police departments and outside organizations, and to authorize the council to remove a member for failure to complete required training. There was one amendment to the bill that the committee made that I did not actually highlight in the packet, just to point out that the committee also amended the bill to require the PAB and the ACC to meet at least once a month. Absent any amendment from the council, that would be in the bill. That's in the bill that's in your packet. The council also approved an amendment to replace the professional experience required for a member of both entities with a member must, quote, be able to demonstrate through professional or lived experience the ability to balance effective oversight, perform objective analysis of an investigation report, and practice procedural fairness. What's left to decide are 3 major issues. One is the compensation for members of the Police Accountability Board. 2, the appropriate staffing and legal support for the PAB and the ACC, and a transition clause. The current bill just says it takes effect July 1, 2022. However, the state law requires that the bill have included a grandfather clause for police officers who are represented by a union that has a collective bargaining agreement that includes disciplinary procedures. That would delay it till a year, till July 1, 2023. So I've provided at the end of the packet in issue 11 an amendment that would clarify the transition of this bill. Although the bill would take effect, it wouldn't apply to a police officer represented by a union with a collective bargaining agreement that's been entered into before June of this year. That includes a disciplinary procedure, which would be our county FOP is one such organization that does have an agreement that goes through July 1, 2023. Last time I was asked for some more information on compensation for board members. And if you look in the packet, Trying to get used to using the laptop here for this. On page, starting on the actual report, starting on page, where's the page number? 12 is a discussion of that to highlight there are more than 90 boards, committees, and commissions in the county has created. The vast majority of them work with no compensation, except for reimbursement for expenses, including child care. There are a few exceptions. The exceptions are the major exceptions are the Board of Appeals, which is the salary schedule that is mirrored for the Administrative Charging Committee. It's $16,000 approximately for a member, $22,000 for the chair. The Board of Appeals is an adjudicatory administrative agency that hears appeals, a variety of appeals, but most of them are in the land use area. And they conduct trials and come up with written opinions. Also, the Merit System Protection Board is paid. The salary is, I have it in the packet here, $88,275 for a member and $10,613 for the chair. The Merit System Protection Board hears adjudicatory appeals of disciplinary procedures, potentially from all employees. However, if you're represented by a union, you can go through the collective bargaining agreement, which is a separate procedure, goes to a labor arbitrator, but they hear all the appeals from non-represented employees, as well as review the merit system and how it's working and provide reports on that. The Racial Equity and Social Justice Advisory Committee was also provided with pay, $2,000 stipend. That was done when we did the racial equity bill. That's about it for the county boards. I mean, I'm not including the Park and Planning Commission and WSSC, which are created by state law with salaries created in state law. Although I think Park and Planning, we supplement the salary for the chair, but they're really in a different situation. That's just some additional, just another point to bring out of agencies that actually do administrative hearings that do it for free. The Human Rights Commission, the Landlord Tenant Commission, the Ethics Commission, and the Commission for Common Ownership Committees all serve without compensation. And of course, the recently created Policing Advisory Committee public members also serve without compensation. The one proviso, if you do want to provide compensation for the Police Advisory Board, is that you need to, or I would strongly recommend that you do not pay the chair or a member of the PAB that is designated by the chair to serve on the ACC, because they're going to get paid as a member of the ACC. And paying them twice creates a constitutional issue of two offices of profit. But that can be avoided without just not paying the chair. So that's that issue. I can move on, or if you want to discuss that issue and make a
let's stay
decision
on that. Thank you very much, Mr. Drummer. Just a couple of other context questions. I know, and thank you for that research and analysis. It's very helpful. We had also discussed that the unique nature of taking what had been an administrative function of an executive branch agency and then transferring over to this body Did you see if in your analysis of the other 90 boards and commissions where there was a similar dynamic or anything in the same universe?
No, I don't think so. They are performing an executive function. There is the Merit System Protection Board, handles appeals, disciplinary matters, but they're an appellate. They're the last line of appeal. The Administrative Charging Committee is not. They're simply making a decision on whether discipline should be imposed. And of course, the Police Accountability Board is really, to the extent that, except for their authority to appoint members to the ACC, their duties are very similar to many of the advisory boards that we've created. They're not actually performing an executive function other than appointing a member of the ACC and the trial board. They will appoint one of the 3 members of the trial board.
Gotcha. And then just last context question, and this was discussed. And by the way, for our audience, just a quick update. Councilmember Rice was involved in a car accident this morning, and that's why he is not with us today. Fortunately, it was not serious, and he has been released, but he will not be joining us today. So just wanted everybody to understand why he's not here. I guess the other context question that he had raised, and so I'll raise it on his behalf, but I haven't asked him this, was the issue of what's the precedents that this may set in terms of, it would totally be organic, right? There's no procedural trigger that would then require us to compensate other boards and commissions, to your knowledge.
No, I will say there was a bill that the council that Councilmember Rice, I believe, was the lead sponsor, had introduced to provide a $1,200 stipend for all the public members of all the boards, committees, and commissions, instead of a reimbursement of costs, if they so asked for it. It would be the choice of the public member. And I've attached the fiscal impact statement. That bill expired without being acted on, but I attached the fiscal impact statement, which showed, I guess, they estimated there would be approximately 900 public members of the boards, committees, and commissions that would be eligible for that $1,200. So, but there's no requirement that if you pay this board, you have to pay another board. That doesn't, other than simply members of other boards saying, hey, what about me? But no, there's no legal requirement. You can pay this one and not pay the others.
Thank you. Just wanted to provide that clarification. Colleagues, does anybody have any questions regarding Mr. Drummer's analysis? There is an amendment that will be moved forward by Councilmember Jawando momentarily. Councilmember Katz, Chair of our, and I should have done this at the beginning to maintain consistency. Apologies, Chairman Katz.
It's perfectly all right. I wouldn't have known how to cut on the microphone anyhow. So, welcome back, everyone, and thank you for being with us. On Mr. Drummer, on page 14, one of you, there's several options to decide this issue. And number 3 says we could delete the statement in the bill that requires no compensation without adding anything. Under 2-145, if the law does not prohibit compensation, the council could provide it in the budget or. And so my suggestion on this is that that's the way we should go. We should figure out how much work is actually involved in this, and as we go forward, if we put an actual dollar number in the legislation, that means that we have to come back and visit it through the legislation rather than at a different time. And I believe, Council President, your office was so very kind to give us the update when there's people who would be qualified to serve on this board might not be qualified to receive compensation from the county because of their immigration status. And so that would put people on this board in some cases that could receive money and some, or compensation, and some that couldn't, and that puts people in a different position as well. I think we need to figure out how we can go forward, and at this point, because of the time constraints, et cetera, I believe that's the most flexible that we could have on this issue. That's literally my 2 cents. Thank you, Mr. President.
Thank you. Councilmember, you have a context question for Mr. Drummer. Yep. Oh, okay. Why don't I go to Councilmember Jawando next? Sorry.
Figure this out here. All right. Thank you.
You got it?
I think so.
Yeah. Okay.
Yeah. Good morning. Good to see everybody. To Council Member Katz's, I got to get used to this. We got a new seatmate. Council Member Katz's point, if you remove the prohibition, that would not, who would set the salary? Would we have to come back? I mean, would that give the executive branch the authority to set a salary or a stipend themselves through regulation, or would they have to come back to us?
All right. I probably should have mentioned this up front. I'm glad Councilmember Katz mentioned this. There's a general law that we already have on the books for boards, committees, and commissions to try and create a uniform system. And it starts out by saying, unless a law expressly precludes compensation, the council may establish compensation for members of a particular group by an appropriation that funds a line item in the budget. An appropriation may establish levels of compensation by categories or subcategories or groups. So what that means is, as long as you take, right now there's a prohibition that says they serve with no compensation. If you took that out, it would then leave it up to the budget. And you would just put in the budget, is there money for paying members of the PAB or is there not? And ultimately, the executive would put something, a recommendation, but of course it's the council's decision as to whether or not. So it would be the council.
So we could say in this budget that we wanted to set it at X amount. And
Absolutely.
That could fluctuate from year to year as budgets do.
Well, I think once you set it, they're going to be serving a term of
Well, you're making
office.
my point. You're making my point, right?
It would be for the full term. I don't think you could change their salary in the middle of their term of office.
So it would be appropriating for the full term that they're serving. We would have to appropriate the amount of money for the full term in the first year, but the money is
No,
appropriated each year.
I know, but you'd be
You're saying
stuck
we
with,
should probably, because the budget's an annual thing. It's not, it wouldn't have to be.
It's an
that.
annual budget. You'd
Yeah.
set the salary in the budget, and then you'd have to keep it up every year, or you'd be running into the problem. If in fact this is
reducing
considered
compensation.
an office of profit, you can't change the salary every year. Like, we didn't like the job you did, we're cutting your salary. Or you did a great job, and we're going to raise your salary. It's got to be the same.
Under to follow the law
Yes.
that's in place.
Yeah.
Okay, I see John Markoff nodding too, so that gives me some, okay. So in effect, if we set it here today in the legislation or we set it by appropriation, it has the same effect, basically, that it's set at that amount for the term of those members. Would that be
Yes.
fair
Yes.
to say? Okay. Is there any other information that we would need, other than seeing what happens with the service of the people of the board, which I understand colleagues have suggested could be helpful in determining the level of work? We are giving them, we know that we're saying you're going to meet monthly. There's an amendment to be considered that I'll support that will add a report requirement from the department to make sure that they're sending the complaints that come in. So we know there's going to be a body of work for the PAB and the ACC. What else would we be, this is kind of a subjective question to you, Mr. Drummer, I think. What else are we missing What are we not going to know in setting this? You've given us some great information about other boards and commissions.
Well, the ACC is going to have the amount of work depending on how many disciplinary matters are referred to them from the law enforcement agencies. So that's going to be, for the most part, telling you how much work they're going to do. The PAB is not really going to be looking at each individual case. They're going to do a quarterly report, so that's every 3 months. They're going to look at how the system's working.
They're meeting monthly.
Well, they may be meeting monthly, but the state law requires them to do a quarterly report to review the outcomes and review the outcomes, not the individual cases.
Sure. Okay.
On a quarterly basis, and they're going to be providing advisory, like the Policing Advisory Committee. In the initial, when you first appoint them, they're going to have the task of appointing members to the ACC.
Yes.
But beyond that,
I appreciate
it's
that.
not going to be, I'm not sure they really have to meet every month.
Yeah, I think, well, you're bringing up a point that, and I'll close here and make my motion, Mr. President, that I brought up last time, is that one of the things we want to do is, this is a serious function, right? They are appointing members of a body that will determine whether there's disciplinary action taken against a member of our police department or municipal police department. They are performing a function of government. They are state mandated to exist to do this. They are going to meet monthly, as we've already decided. We talked about this last time. The definition of review is not defined in regulation of what review these cases means. So really, they're going to do as much work as they're qualified and able to do. And I think one of the ways we set the expectation that they dedicate time and do that work is by compensating them. So, but considering the appropriation, I'm going to modify my amendment at this point and just live to bring that up another day after talking with colleagues. And I'd like to move that we remove the prohibition against the compensation at this time, and then we can come back to it in the budget.
All right, that was moved by Councilmember Jawando, seconded by Councilmember Hucker. Let's do a discussion on that point. And Councilmember Reamer, you had chimed in. Did you want to speak to this specifically or more broadly regarding the issues?
Well, I don't have a whole lot more to add, but I just wanted to observe that what makes the ACC, and I think to an extent the PAB, different is that it is indeed executing the disciplinary process of the department. And that is doing the work of government. And it is acting upon an authority that has been delegated to it. And as I looked at the other examples of quasi-judicial bodies that Mr. Drummer provided, it seems to me we might indeed want to ensure that those various bodies are compensated as well. Certainly the ACC, and I'm also willing to compensate the PAB. One of the questions that I've had is about the volume of work that the ACC might have, and to what extent it's a standing committee that won't change, or will members go on and off over the course of the year? Could you comment on that, Bob? The ACC?
The ACC is going to be appointed for a 3-year term.
3-year term. And the PAB will be
a 3-year term.
3-year term.
In the way the bill is, although the original appointment for the PAB would be staggered. Just the first time around, so that they don't all go off at the same time.
Okay. Thank you.
Council Vice President Glass.
Thank you, Mr. President. So I appreciate us picking up this conversation and the comments that Mr. Drummer made and reiterated the committee recommendations and then summarize some of the conversations from last week. And last week I did ask some questions regarding the parameters for which individuals could get compensated, referencing the 90 different boards, committees, and commissions, referencing the question that Councilmember Katz asked today about eligibility and qualifications for some of those in our community who do this type of volunteer service. And in that week time since, I dove a little deeper into the roles and responsibilities, and I like the way that Councilmember Reamer just phrased it, that what sets this group up, the PAB, what sets it apart from some of the other bodies is that it is really a quasi-judicial group. And so the added and nuanced responsibility, I think, does require additional resources. I think it does require some level of compensation, and I appreciate Councilmember Jawando amending the proposal so that we can have that conversation and figure out exactly what, one, is available in the budget and what is just and equitable given the time that these people serve. And so I will support that motion.
Thank you. I don't see any other, Councilmember Katz.
Thank you very much. Mr. Drummer, well, I'll let you. Mr. Drummer, Bob, thanks. Yeah, not a problem. I know that there, and that's part of the problem with being in and together. We have these side conversations. Is there a difference between a stipend and compensation?
Well, they're spelled differently.
Yeah. You know what? I'm sorry I interrupted you now. Go back to talking to Earl. Yeah.
I mean, I think compensation is generally meant to, compensate you for your services. A stipend is sort of like, well, we'll give you some money, but we know it doesn't come close to compensating you for your services. I think, in general terms, but in reality, money is money. It's going to come. It's going to come to them.
Well, my question being, can we give someone a stipend who has their immigration status that couldn't receive compensation?
No, it would be no. There's no difference there.
Okay, all right, very good. Thank you, Mr. President.
Thank you, Councilmember Reamer.
I just want to think this through a little bit more here. Okay, we have a PAB with 9 members, right? Is that right, Bob?
Yes.
All right, and the PAB will select 2 of the PAB members will be the ACC members.
No, the chair of the PAB will be on the ACC unless the chair designates a different. The chair of the PAB will be on the ACC unless the chair also has the option of designating a different member to be on the ACC instead of the chair.
But
so it would be just one member of the PAB will be on the ACC, either the chair or someone designated by the chair.
Oh, it's just the chair or
then
the
PAB will select 2 other civilians to be on the ACC who are not members of the PAB.
I see. One of my concerns would be that we want to attract people to the PAB who are all potentially capable of serving on the ACC, I should think.
At least the chair.
What's that?
At least the chair.
But we don't recruit the chair directly, right? I mean, the chair would be elected by the body, I should imagine.
No, I think the executive appoints the chair, I believe.
Yes.
I think the executive does appoint the chair.
County executive appoints the chair.
And the council confirms.
The point I'm trying to get at is that we want the PAB to have a wide number of people who are capable of serving on the ACC. And
Sure.
because they know going in that they have the time available and the expertise to play that function. And so I would worry a little bit if we're not offering compensation, some will approach the commission more like perhaps another advisory commission where, it's a little bit looser. You try to make the meetings, you're there to have some input, but it isn't necessarily because you think you could get pulled into something as weighty as being on the ACC?
Well, it's going to be a decision made up front. I mean, the PAB chair most likely is going to be on the ACC, unless we appoint a chair who decides they don't really want to be on the ACC and they want to designate somebody else. But there's only going to be one of those members that's on the ACC, and it's going to be for a 3-year term once they're appointed. So they're not.
So you rely upon the executive to.
I'm not sure that's a fair statement to say that any of them are going to be pulled into it. They're going to, up front, they're going to know. I mean, when you appoint the chair needs to be qualified to be on the ACC. The other members, only if they're going to replace the chair. But if they do, they're replacing the chair for the entire term of office, not just hey, it's Tuesday, I can't make it. Why don't you go to the meeting for me?
So certainly in the recruitment process for the PAB, the council and the executive will want to make sure that there is at least the chair who will be capable to serve on the ACC.
Absolutely.
As well as perhaps a understudy or two. But other than that. All right, well, that's clarifying. Thank you.
I've got Councilmember Joando, followed by Councilmember Friedson.
Thank you. I just want to be clear that I intend to pursue in the budget with colleagues a payment amount for the members if this amendment were to pass. I'd be comfortable setting it as the amendment in the packet on page Circle 106 says at the $16,000. I'd be comfortable doing that right now. I don't think that's the will of the body, which is fine at this moment. So we can set it during appropriation. I will say that it's really important, which is a good thing. I think the majority here, you're hearing, agrees that there should be some pay, and we just have to figure out what the amount is. I don't want to speak for everybody, but that's what I'm hoping. Be hopeful. I think the other reason to pay is that this cross person, and my amendment would have not allowed for the double payment of the chair, is that if you don't pay the PAB, you have this person that's floating between two and serving on both that's getting paid and the other people aren't, which also creates a dynamic that I don't think is desirable for something that's this important. And so I think Councilman Reamer's point about wanting to send a strong message, I hope this amendment will send a strong message, and then the budget will be able to send an even stronger message when we set an amount. But I think what you're hearing today, at least from majority of colleagues who have spoken, is that there does need to be pay for the PAB, which is a step ahead of where we were a couple weeks ago. So just wanted to clarify that. Thank you, Mr. President.
Thank you. Councilmember Friedson.
Thank you, Mr. President. Appreciate the conversation and the discussion. Just a couple things. One, I just want to make sure we're not diminishing the work of the people who serve on the 90 boards, committees, and commissions, because there's a suggestion made as part of this conversation that somehow those who serve on those organizations and do important work on behalf of the county are doing so in a less serious or less committed way. And I think it's an unfortunate part of this conversation. I just want to clarify, I don't think anybody believes that here, and it seems to be some of the comments that were made, and I personally don't believe that. I don't believe that the county believes that, and I just want to make sure that it's clear as part of this conversation. I just want to clarify two things. One, as part of eliminating this, it would provide the flexibility to address the double compensation challenge, right? There's two issues here. One is the annual budgetary issue, which is up to the discretion of the council, generally at the recommendation of the county executive. And then there's a constitutional issue related to the state constitution of payment for public positions of profit. And both that's a double payment issue, and that's also a changing compensation in the middle of a term of service, which is prohibited under the Maryland Constitution. So we talked about both of these. I think there was a little bit of confusion. I just want to make sure that we clarify there are two legal issues here that have to be addressed. One is a county code issue, and one is a Maryland State Constitution issue. Is that correct?
Well, yeah, that's correct. I mean, what you said, there's actually two constitutional provisions that come into play. One is, you can't hold two offices of profit. I think the law would be if you hold 2 offices of profit, when you accept the second one, you automatically resign from the first. And then there's if somebody, you can't change the salary of somebody in an office of profit in the middle of the term. That's why the council members can't. Now, you can put in a CPI clause, which we do for the Administrative Charging Committee, that works automatically. But you can't.
Right, it's part of their set that's part of the set compensation, but it's not a change to increase or decrease the compensation in the middle of the term.
Right. So there's 2 actual constitutional issues, and then of course there's the county code issue. If you don't put in any if you don't put a prohibition on compensation in the law, then you can set compensation in the budget.
And when we set compensation in the budget, we can handle the 2 positions of profit issue.
Yeah.
So that will address that. Okay.
Yes.
The other thing that has been discussed here quite a bit is this question of a quasi-judicial comparison. And I think there's a little bit of confusion where we've interchanged to a certain extent the ACC and the PAB. And I just want to clarify, the ACC is a quasi-judicial board.
Technically, no.
Is the PA, okay, please explain.
They're really not. Neither one of them is. The ACC, the Merit System Protection Board is a quasi-judicial. They actually conduct, adjudicatory hearings where they hear evidence and make a decision on the record. The ACC is close, but they're not going to hear. They're not going to conduct a trial. They're going to look at an investigation report. They may watch some of the body cam. They can watch the body cam video. They can actually have witnesses come and talk to them that were interviewed. Although I suspect they're not going to see the police officer who's being charged, likely. But they can do some of that, but they're not going to hear like arguments. It's not going to have each side's not going to have a lawyer. They're not going to hear an adjudicatory hearing. They're going to make a decision as to whether the case goes forward, which is really exactly what the police chief does now.
Okay, so the
PAB doesn't do anything close to adjudicatory.
So just to clarify, from your legal perspective, the investigatory functions that are currently in the executive branch and handled by the police chief are being moved to the ACC.
Yes.
Not a quasi-judicial board, but the investigatory functions currently handled by the police chief are, under this new system, largely going to be handled by the ACC.
Yeah, it's
Is that
not the
accurate?
Well, not the entire investigation. The investigation is still going to be done by the police department. They're going to look at the investigation and make a decision whether there's discipline. I don't really consider that quasi-judicial because they're not really hearing a contested case where there's both sides are represented. The officer's not going to come in there and defend their actions like they would at the trial board, and nobody has. But the ACC is going to look at the evidence produced by the investigation and make a decision on whether this thing needs to go forward.
Okay, so at least some of the investigatory functions currently handled by the police chief in the executive branch will be moved to the ACC.
That's
but
right.
in your opinion, not a quasi-judicial body.
No, I don't think so.
How about the PAB?
PAB, not even close. The PAB is going to do an appointment for the ACC members, which is an executive function, to make an appointment to a board. So they are taking over that. And beyond that, they're going to review how the system's working, which right now is something that the Policing Advisory Committee is probably within their jurisdiction to look at not look at individual cases, but look at how is the system working? We think the disciplinary system isn't working well, or it's working great, or this has been an improvement. We think you should change this.
So an appointment function and an advisory function.
Yes.
Are there other functions that you have not mentioned that you believe that the PAB will have under law?
I don't think they have any other functions, really. They have a very important appointment function and a very important advisory function. I wouldn't belittle that at all. I think it's very important for them to have citizens reviewing the police department's operations and specifically the disciplinary system and providing reports to the executive and the council on how the system's working. I think that's very important, but it's not a quasi-judicial.
Okay, thank you. And last question. Last meeting when we were discussing this, the Police Advisory Commission, there was a suggestion of potentially at some point thinking about merging the Police Advisory Board and the Police Advisory Commission by a colleague. If we were to do that, how it, would an amendment here to remove the compensation for this board, if there was ultimately a merging of the other board, I guess functionally we could just eliminate the Police Advisory Commission and create this as a replacement commission, which ultimately, if there is approval of funding for compensation, would be compensated?
Yeah, the way I understand it, the Policing Advisory Committee right now probably has a little broader charter as far as advising on police operations. The Police Accountability Board is really supposed to be advising on how the disciplinary system is working and the, police misconduct, which of course is a very large part of citizen overview, but review. But yeah, you could expand the duties of the PAB to include all of the duties that the Policing Advisory Committee has. You could do that. Let
me just ask a direct question here on this.
Do
you have are there any legal issues that would prohibit, future decisions on these different boards and how we treat them if we potentially at some point merge them just by eliminating the compensation prohibition? Since we would have one that is and one that isn't.
No.
Okay, thank you.
Okay, so we have a motion on the floor in a second. I do have a couple of comments here. And I appreciate Councilmember Friedson acknowledging that, of course, we greatly respect the work of all 90-plus boards and commissions who do fantastic work and advise this body and the county executive and the executive branch agencies in a way that is incredibly impactful and meaningful. One of my favorite sessions during the year as chair of HHS is when we preside and over 2 days receive updates from more than 30 of those boards and commissions that help guide policy making in the area of public health and wellness, period. We also want to acknowledge our Police Advisory Commission and their outstanding work. And I know there has been a suggestion of the possibility of a merger, and I know that that feedback has not been asked of them specifically. And so I just want to let them know as they watch and observe. We thank them for their continued service, and obviously we will have conversations at some point at the appropriate time if it does make sense to merge. But that is not being decided right now. I do have we have a timing issue here. I completely agree with Councilmember Dwando's assessment that it appears that the majority of colleagues are interested in compensation but need some additional information before coming up with a number that they feel comfortable with. But I also remind colleagues that we have a timing issue in general with this bill. We are trying to enact it as quickly as possible so that we can begin the recruitment process. We don't reconcile the budget until May. And so we could advertise without there being a specific compensation amount and an acknowledgement that there may be one. But I suspect that may in some ways make it more difficult to recruit those members. So I will also support the motion because I'm not prepared right now to determine what level of compensation is appropriate, although I don't think it should be the same as the ACC personally. I also want to acknowledge that we should set a goal, if we are going to do this, of doing it in this legislation with that number, because if we don't, then it again creates an outstanding item that could hinder our recruitment, which would be a problem. So We're not voting on this today, but we will be voting on this motion right now. But I do suggest we come back to this as early as next week and resolve it, and not kick it any further down the road. So we have a motion on the floor and a second. All those in favor of Councilmember Chawando's motion, please raise your hands. That is unanimous among all those present. Yes, Councilmember Chawando.
I appreciate the vote and your comment, and I agree that would be preferable if we could figure that out and come back, so we'll work on that. I just wanted to point out one thing that I heard Mr. Drummer say, and I just wanted to make sure it's clear for the record. My understanding that the ACC can interview the officer with a representative, and that's expressly stated in the state law.
They can, but I'm not sure the officer is required to do that.
Okay. Well, you said they wouldn't. I just want to, we got to be very clear here. I think you're taking a view that is not necessarily consistent with the law. So I just want to make sure we're being clear.
Okay. Yeah, I probably shouldn't have said wouldn't. It depends on the officer and the officer's attorney, and my guess is most defense attorneys would not want them to do that.
Okay. I appreciate it. I just, again, to the point of, this is an important body. Both, all of our committees are important, but this is really important. And so I just want to make sure we're getting it out there, what it's going to do. Thank you, Mr. President.
Thank you. That moves us on to the next outstanding item. Mr. Drummer, what is that?
Okay, staffing. And the staffing issue is really, right now we've got the executive branch. It's in the executive branch. It's an executive function. That's probably where it belongs. If you do that, you can either have the county attorney's office provide legal support. I described last time what happens now with the county attorney's office, or you can require the county attorney's office to retain outside counsel to do this, to do the work, to provide advice to the administrative charging committee. The county attorney's office would still be representing the police department in the prosecution of the case, and would still be representing the internal affairs division in to the extent they need legal support in doing the actual investigation. So you'd put another lawyer in the middle representing the ACC. That, as I tried to explain last time, I'm not sure it's the most efficient way to work. Right now, the attorney who is assigned by the county attorney's office will provide advice to the internal affairs division, will then also provide advice to the police chief or the assistant chiefs who are doing the job of the ACC. The ACC is going to take over should we impose discipline, and then ultimately would be in the best position to prosecute the case if the police officer rejects the discipline and asks for a trial. This way you would have an independent attorney who would be billing essentially on an hourly basis, which, besides the fact it's going to cost more money, I'm not sure it's the most efficient way to work, but it'll work. The outside counsel will certainly be able to do that, provide the advice to the ACC. The county attorney's office won't be involved in that, and they'll just take the case if it goes to trial and handle the case at trial. So that's kind of the choice. I believe, I'm trying to remember if there was already an amendment in the bill about dedicated staff. I don't remember if that's actually already in the bill.
Page 16.
It's 16. Clerk, councils. Yeah, well, that's what we talked about, the special counsel, special counsel. Those are your options. I think everybody agrees that they're going to need full-time dedicated staff. But the amount of staff that they need really should be left for the budget, because it's an annual thing, and it's an annual budget, and you'll have a better idea. I mean, you'll probably want to get some input ultimately from the PAB members as to, and the ACC members, how much staff they might need. Start out with some dedicated staff and add as needed. But the real question for you to decide is the legal counsel for the PAB and the ACC. It's quite possible it wouldn't even be the same if you require outside counsel. And John Markovs is here if you want to ask him about how it might work. But it might actually be different attorneys representing the ACC and representing the PAB. It doesn't have to be the same one. They're really not, they may not always see things the same way.
Thank you, Mr. Drummer. So I have a question for Dr. Stoddard on behalf of the administration. I do have a question for Mr. Markovs. So if you could come down, and I believe some of my colleagues do as well. So was there a dedicated staff person put in the county executive's recommended FY23 budget to staff this? I know you're on the record in support of that, but I just want to clarify if that was put in.
No, so it's an NDA that lists an amount, but we haven't put items underneath that because we wanted to start the budgetary process. The conversation we've had, I've had conversations with members of the county attorney's office as well as some others. We believe, our intent is to have a full-time dedicated, likely a director level position, and then administrative support, and then convene the PAB ACC members and get some feedback on what they think. So it likely would be, it is reflected budgetarily in the budget, but it's not, there isn't a line item for dedicated staff, but that was our intent. I believe Councilmember Jawano had said last week, and we support that full-time dedicated staff would be the direction, and we agree with that.
And did you have a sense of a recommendation of what level classification that staff member may be?
Yeah, we discussed actually having it be in either an M2 or an M3 position, more likely an M2 position that would be appropriate for, we call it the executive director. I believe that has some meaning in law, so something like that for the PAB, or PAB/ACC is what we're thinking, then some administrative support staff, which would be,
And for the millions watching at home, Dr. Stoddard, could you describe an M2 position? I know what it is, but for the members of the public.
Yeah, I don't have the direct definition in front of me, but it's a senior level management position. Obviously, department directors are typically M1 management level 1 positions. Typically, M2 positions are critical programs or division chiefs. Level is an equivalent of an M2 position in government.
And these are merit positions, correct? Not appointed.
Correct. They are merit positions. We felt there would be some good to have some consistency with a merit position across as you transition board members out between the PAB and ACC, having some institutional knowledge within the career staff would be appropriate for supporting such boards and commissions.
So just colleagues in the queue, I've got Councilmember Katz, followed by Councilmember Jawando, and then Councilmember Friedson. Before I get to the queue, Mr. Markovs, I had asked this in our previous session and used it as an example. We regularly seek outside counsel for various cases, so the Office of the County Attorney is well-versed in working with outside counsel on a case-by-case basis and does it well, and to bring additional areas of expertise. Speaking for myself, I think the independence of this investigations is obviously important for many reasons, but could you describe from the county attorney's office's perspective what it looks like and what you think it may look like to seek outside counsel in these specific cases?
Sure. Very nice to see all the council members. Thank you, Council Member President and Vice President Glass. Let's talk. There are three options right on the table. One was to leave the council, outside council, in the legislative branch. I think Mr. Drummer's made that pretty clear. It doesn't make sense. It's an executive function, the discipline of police officers. So that leaves you with the two other options that Mr. Drummer discussed. One was that it stay in the county attorney's office. And in the memo, I think it's at Circle 103 in your packet, is the memo I sent to President Alvarez highlighting how the discipline process works. So using outside counsel in option 2 would be taking away the charging representation from the county attorney's office. Right now, we have a lawyer that represents IAD, it does the investigation, works with the police about the discipline, and then takes that case to the trial board. So what Mr. Drummer refers to as adding a component to that is putting outside counsel in and representing the ACC. Now, one of the things that I wanted to address today was that I think that the PAB and the ACC might need separate counsel. They are actually, it's not a committee of the PAB. The ACC is not a committee, so it's a separate standing board. And as a result, I'm thinking that you probably need two outside counsel, one for the PAB and one for the ACC. And the counsel for ACC would be responsible for reviewing the file that comes in from IAD, which would be presented basically from my lawyer and the police. The lawyer that's doing the IAD investigation would work up the file, work with the police on their investigation. That file gets presented, I understand, to the ACC. The ACC makes a decision about discipline. Then it comes back to the police, discipline's presented, and then potentially if the discipline's not accepted, then it goes to a trial board. And House Bill 460 talks about who sits on the new trial board. In terms of outside counsel representation, my thinking is that the counsel would be maybe a former U.S. attorney, maybe a former state's attorney, maybe an assistant U.S. attorney, somebody who's got prosecutorial background to be able to review the charges that are being brought. For instance, the lawyers that I have in my office, specifically the one that's representing IAD right now, is a former state's attorney who's got experience bringing charges in criminal context. I mean, these aren't criminal charges, but they do sound like that in terms of assault and excessive force. So I'm thinking that the representation that I would bring under the Charter, Section 213, if you choose the second option, which is to have outside counsel represent the PAB and the ACC, that I'm probably looking to bring to you somebody who has extensive experience prosecuting cases, who can understand what fact files look like and to make determinations as to what the charges should be, consistent with, what comes out of the, I don't believe we actually have the guidelines yet, right, from the state as to the discipline. But somebody who could be able to handle that, and he or she would be probably with a firm, but they wouldn't necessarily, they could be a solo practitioner. I also highlighted in the memo that I'm unsure how much work has to be done. The PAB has a different role than the ACC, and I agree with Mr. Drummer, they are not, neither one of them are quasi-judicial boards. They just don't. They're not trying the case, they're determining the charges. So by choosing option 2, you're removing the county attorney's office, where we normally have done, and I've been in the office 15 years, we've done plenty of firewalls and done representation. I've never heard a single complaint about the county attorney's office impartiality in handling IAD investigations and charges. But if you're so inclined to go with option 2, which is to have separate counsel for both boards, and maybe it's the same lawyer, I'm still thinking about that. But if you have outside counsel for that, I am looking for somebody who has the experience to bring those charges and review that file.
Thank you. That's helpful. Councilmember Katz, followed by Councilmember Jawando, and then Councilmember Friedson.
Thank you very much for, Mr. President and Ms. Marcus. Let me be very, very clear and say that I, too, have never heard a complaint about any of the handling from the county attorney's office. I thoroughly respect them and will continue to thoroughly respect you and your entire office. I do believe, though, in this board, the fairest way for us to go forward is to have that firewall, is to say that it's outside counsel, and there again, the decision would have to be made whether it's with a plural on counsel. But I believe that's the fairest way to go forward. And on page 16 of the packet, I guess amend lines 87 through 90 F, that this chief administrative officer must provide appropriate staff to the board and make available to the board services and facilities that are necessary or appropriate for the proper performance of its duties. The county attorney must serve as counsel, retain special legal, and I guess maybe there should be some way to say that there might be more than one legal counsel, approved by the council to serve as counsel to the board. And then under that, amend lines 147 through 150. The chief administrative officer must provide appropriate staff, and I do believe we should add the words dedicated full-time staff, to the committee and make available to the committee services and facilities that are necessary and appropriate for the proper performance of its duties. The county attorney must retain special legal, there again, it could be more than one counsel, approved by the council to serve as counsel to the committee. I believe that's the fairest way to go forward, especially in the very beginning when we don't know exactly what level of work is going to be associated with that. So with that, I will make that motion.
Second.
That was moved by Councilmember Katz, seconded by Councilmember Jawando. Councilmember Jawando, you're next in the queue. Do you want to speak to this or something more broadly? Councilmember Jawando.
Okay. Thank you. And Mr. Drummer, I just wanted to, you noted in the packet, I think we just, between this session and the last session, I'm glad my new seatmate here caught the dedicated full-time. Just want to make sure we add that in there. I do second it. I think that we did discuss this at the last session. I think this is really important for the independence of the body. I have the utmost confidence in the county attorney's office as well as our own attorneys. But again, this is about how it's perceived by the public when there's been a proposed violation of public trust, an alleged violation of public trust. And we want to make sure that, and this was, I think, of the things that we heard from the public about, this might have been the number one issue as far as wanting to see independence. So I think this is a good step forward and urge that we would move forward. I would ask Mr. Markoff, as you keep in touch with us on what you're thinking here, because I think that's those decisions of, is it one attorney or two, who the pool is. Talk to me. Actually, I do have a question about it. So this would mean, if this were to pass, you would pick somebody, and then who has final sign off on it? Just to be clear,
under the Charter 213, as you know, the county attorney's office is counsel for the county, the entire county. You, the executive branch, all of the departments. But there are circumstances when I do come over, and I've come over the years with Mark Hansen, our former county attorney, in which we've asked for outside counsel to be appointed for special or extraordinary matters. Usually because, especially in litigation, we don't have enough full-time employees, FTEs, to be able to cover, we're fully employed. And then when we get a major piece of litigation, or I want to pursue outside litigation, like we did with the Jewel, Wells Fargo, Bank of America litigation, the opioid litigation, I come over here and I ask for permission to hire outside counsel under the Charter. So what would happen is that I would go out and try to find the best candidates or candidate, maybe multiple, and I'll come over and do a closed session briefing, because that's a legitimate basis for a closed session briefing, is to discuss legal counsel, and come back to counsel and have a discussion with counsel about who to hire. And obviously when I submit somebody for approval, it'll come before the full body for approval. Perfect. So you'll have an opportunity to approve outside counsel. Then after that, the process would be to sign through the county attorney's office the retainer agreement. And so I would be responsible for reviewing bills, but we also submit regularly to this body our outside counsel bills. So you'll see exactly how much is being expended for outside counsel for representing the PAB and the ACC.
I appreciate that. We're used to seeing bills up here, so that's not
Understood.
Not uncommon. Appreciate that, and I also want to say thank you to the council president for saying the first millions watching at home from the dais in 2 years. So there's some kudos for that. Thank you, Mr. President.
Thank you. Councilmember Friedson.
Thank you. Appreciate this conversation too. We are chock full of very fascinating conversations today, and obviously reflects how important this bill is. Totally agree with dedicated full-time staff. I think that's absolutely essential. And I also think that the independence is at the core of what this body is intended to do. I guess my question, and I'm just not sure, is whether the options that were presented to us are the only option. I mean, we do have independent functions in county government. We have an Office of Inspector General, which by its definition has to be independent. And I'm just curious if there is an option to have full-time counsel, whether it's requiring the M2 position or some similar position to be an attorney, to serve an attorney, like how the Ethics Commission works, another independent body. We don't hire special counsel that I'm aware of to oversee ethics complaints. We have, Mr. Drummer, were you going to respond?
I was just getting
or
ready to
clarify?
respond. Just
Yeah,
pushing
and
the
so
button
I'm just wondering whether or not, because the independence is critical here. I think the outcome to me is less clear. I mean, we're still learning about how this is going to work, what the needs are going to be. It seems to me that we're enshrining into law a requirement to outsource this function rather than requiring into law, that the county attorney may retain special legal counsel approved by the council in order to ensure independence and impartiality, which I would personally be more comfortable with, which would still allow us to move forward in this direction, but wouldn't require it. If we learn that there's a better way to do this, we're going to learn how other jurisdictions throughout the state do this. But I'm just curious from your perspective, our council attorney and the county attorney, whether or not that is possible, whether or not we could have independence within county government that isn't in the same legal office, so to speak, as other functions.
The problem that arises is the Charter Section 213, which gives the county attorney responsibility to represent all the agencies and departments, unless there's an exception elsewhere in the charter, which there is for the Ethics Commission. There's actually a provision in the charter that authorizes the Ethics Commission to have their own attorney. There is provision for the council to hire their own attorneys as well in the charter. It doesn't mean that the county attorney doesn't represent the council, but the council does have the authority to do that. But beyond that, you would need a charter amendment to create a independent attorney position, full-time position, outside of the county attorney's office to represent this board. I did point out, unless you put it in the legislative side, but it's not a legislative function, so that raises a different issue of separation of powers between the executive branch and the legislative branch, and puts you into a position that the council has not been in before. So I will say this, that your suggestion about changing the must retain legal counsel to may retain legal counsel, or even should, has some benefit, I think, because you're setting yourself up for having outside counsel where you may not need it. If in fact you didn't put anything in here, but you said to John Markoff's, we want you to hire outside counsel this year for this person, he's going to do it. So if you just put may in there, I think you could direct him to do that as well. The must is something that I think, I heard that some people wanted. They wanted to ensure that it'd be outside counsel. But you are setting yourself in stone, not in stone, in legislation, that you'd have to come back and amend if you wanted to change it to use outside counsel. And again, as Mr. Markoff's pointed out in his memo, outside counsel is running in excess of $400 an hour. So do you want to hire outside counsel to And I don't know how much time they would spend. I mean, they could be watching all the body cam video at $400 an hour. Maybe not. I don't know. They'll do what they think they need to do, under their own ethical obligations. And, but you can't just create a position. I mean, that was my first thought, was why don't we just require an executive director to be an attorney? But you can't really do that. You could hire somebody who has a law degree to be the executive director, but you can't put it in law. They can't actually be the counsel, but they can have that ability, that knowledge. There's no reason you couldn't hire somebody as an executive director who was an attorney, but they wouldn't be the counsel for the board.
So, okay. So you could require, I got it. Okay. Thank you, Mr. Marcos.
Unless you have a charter amendment or it's a legislatively created office.
Well, we don't have the time for a charter amendment between now and June, unfortunately. There's no elections.
The language must. Mr. Drummer and I had a conversation about that. I mean, that does force something on the county attorney's office that is outside the charter. So shall or should or, recommend, but must is a word that requires us. Now, practically speaking, the county attorney's office, if the council says hire outside counsel to represent the board, whether it was in the legislation as a must or not, we're going to hire outside counsel. To Bob's point, if you say must, you have changed the game a little bit. I mean, I didn't take complete offense over the charter. I mean, the charter gives the county attorney's office independence to hire outside counsel subject to council approval. You're forcing the county attorney's office by this legislation to hire outside counsel, to Bob's point. So, again, I think it's form over substance. The reality is going to be that the county attorney's office will hire outside counsel to represent the board, whether it was in the legislation or not. But you're making it mandatory, which runs afoul a little bit of 213 in the charter. But again, the reality is, of course, the county attorney's office would hire that outside counsel.
Appreciate it. Asked and answered. My initial question, my personal preference, I appreciate the reason here, and I think there's 100% agreement on the need for independence and for full-time dedicated staffing. I would be more comfortable personally with should retain or may retain in order to ensure, independence, but I will abide by the will of the body on this because I support the overarching goal here. So unless there's interest among the introducers of the amendment, then I'll move on.
Nope. All right, so we have a motion on the floor and a second. All those in favor of the motion move forward by Councilmember Katz, please raise your hands. That is unanimous among all those present as well. All right, we are going to stop. Yes?
I just wanted to clarify to make sure we all are on the same page. It's my understanding that motion also includes adding the language that there be dedicated full-time staff, which is an amendment that's in the packet as well. So that motion was for both. That's my understanding.
Yes.
Got it.
Great. All right, we're going to break there on the Police Accountability Board Administrative Charging Committee Expedited Bill 4921 and pick up the rest of this in our next council session. Thank you all very much for joining us this morning. We're now going to move on to the consent calendar. Colleagues, we have to break at 12:20. Because the county executive is having his press conference regarding the release of his budget at 12:30, and wires are being crossed, and they need access to the county cable channel. So I humbly request just to know, are colleagues going to speak to consent calendar items? Is anybody going to speak to one?
Very briefly, I was going to say.
Okay, briefly. All right, then I think we've got time then. Can I get a motion to accept the consent and before we do that, let me note that there has been a slight change. We will be removing item number N, which we will be delaying for further discussion. We found out some information in real time, so we will be moving the consent calendar without item N, but we'll be coming back to that item at a later date. Okay. We don't actually need a motion on it, I found out. So can I get a motion to accept the consent calendar without item N? So moved by Councilmember Hucker, Seconded by Councilmember Katz. Discussion. Council Vice President Glass. Followed by Councilmember Reamer. And then Councilmember Jawando.
Thank you, Mr. President. I just want to extend my appreciation to my colleagues for supporting a resolution that expresses our joint support for our public health officers and the work that they do. You know, it is important that today, the first day that we are back here in person doing the people's work, that we recognize the road it took to get here. And it was not an easy one, but we as a community came together. And over that time, we were ably led by some incredible public health experts and officers. For most of that time, it was Dr. Travis Scales here in Montgomery County. And the work that was undergone was not an easy one for any of us, for the public, but especially for public health officers. And again, for Dr. Travis Scales, who withered public scrutiny that verged on racist and homophobic language at times. And the purpose of this resolution is to express our support and unity for civil discourse, for having a plan to move forward, and for continuing to follow CDC guidance. And that's what we've done. That's what we've continued to do. And as we move forward in this new normal or next normal, as was entered into the lexicon earlier today, I hope that we are able to do that with our community with a level of discourse and decorum that benefits us and all of Montgomery County. So thank you.
Thank you. Well said. Councilmember Reamer, followed by Councilmember Jawando.
Okay, I'll just be super brief since we're so short, but first I'd like to just be added as a co-sponsor on item O, the resolution concerning our public health officers. I wanted to speak briefly to two items that are on our consent calendar today. The first is the special appropriation for the expansion of sports leagues for girls. I want to really thank the council president for his co-lead sponsorship and our co-sponsors, Councilmembers Friedson, Katz, Navarro, and say this is an exciting effort to create programming that girls want to play, in sports that girls want to play more often. We have a real issue with girls dropping out of sports that become, more dominated by boys as they age. And the county has never provided, as our former rec director has observed, volleyball as a league sport, or lacrosse as a league sport, or softball as a league sport. So if we want girls to play, we have to actually offer sports that are very popular. And so this is an effort to get that going this spring, and then we will follow it along with an annualization of the program in the budget for the upcoming fiscal year. So I want to thank the rec department and Vivian Yao for their assistance in preparing this. It's been very carefully thought through with the rec department as to what programming they can stand up this spring and early summer as we build towards annualization. Secondly, I wanted to just comment on item E, which is the appropriation for the economic development programming to support the development of black business in the county, black-owned businesses, and MFD-owned businesses. We've been working on this at the Fed Committee now for about a year, working our way carefully through a range of ideas, and there is a lot here. It's really, we're going to seed the creation of a new incubator strategy for minority-owned and women-owned businesses. We are going to seed the creation of a CDFI that could provide lending and capital. We're going to back the proposal to create a database for black-owned businesses in the county. We are going to support training for businesses in procurement, so to help our businesses here, minority-owned businesses, especially black-owned businesses, figure out how to navigate the pathways to get contracts from companies or federal or state government. I want to thank Councilmember Jawando for leading this effort with me, and Councilmember Friedson for his support. And we will have an event tomorrow, and we will talk about these matters in greater detail, and I look forward to bringing it to a conclusion. Thank you.
Councilmember Joando, followed by Councilmember Navarro, and then Councilmember Friedson. Councilmember Joando.
Thank you, Mr. President. Also on those same two items, really excited that we're moving the youth sports for girls. Point of personal privilege, my daughter completed her truncated MoCo rec basketball season undefeated and won the championship on Saturday, despite the snow. So we were very excited about that, and it's just a testament. The young ladies out there were so excited to be back after 2 years. The second item, the Black Business Initiative. This is such an important item. I really appreciate working with Councilmember Reamer and with the support of Councilmember Friedson, and I think Councilmember Rice is also supportive, and Councilmember Hucker, and I'm sure everyone will be supportive. We know the last 2 years have been particularly hard for all of our communities, but communities of color have been hit really hard, whether it was the health pandemic, the fallout from death and case rates, but also our businesses. There was one study that showed between February and April of 2020, more than 40% of black businesses disappeared. You just think about that. And then if you look at who received aid, those that were left behind, 60% of PPP recipients were white, only 29% black. Just the disparities that are already embedded in our society are deep and long lasting, and we don't thrive unless every community in our county thrives. And so we'll talk more about this tomorrow, but I'm really excited about this package of initiatives that are going to support our black business community, including the Black Collective and the Maryland Black Chamber of Commerce, who will be supporting. And I'm really glad to hear this morning that the county executive has included in his budget continued funding outside of this special appropriation for next year. So this will be a sustained effort. So we just wanted to speak to that and appreciate it, Mr. President.
Thank you. Councilmember Navarro.
Thank you, Mr. President. Absolutely associate myself with these remarks. I think it's so awesome that we are focusing on girls' sports. It's so important. As I said earlier, I think there's just a real connection to a lot of opportunities to promote well-being and wellness, and also mental emotional health, and this really does help in that respect. I obviously want to also be added to the proposal item 5E. I think this is also a really important step forward. It really does connect nicely with some of the work that we have done over the years in the Government Operations and Fiscal Policy Committee to make sure that we're continually trying to expand those opportunities and access to opportunities for our minority-owned businesses. As a wife of someone who started this business in the basement of our home in Wheaton and grew it to a company that at one point employed over 150 employees, Black-owned business, I can attest to how important it is for especially local government to do everything possible to open those access to opportunities, because they're not necessarily readily obvious or available. So please add me to that enthusiastic support. And I do thank the members of the Fed Committee for taking the initiative to get this rolling. I think this is really the beginning of a lot of things that this council can do in the future to be so much more strategic and intentional about expanding those opportunities and access to our extraordinarily entrepreneurial community here in the county. So thank you.
Sorry. Thank you very much. Councilmember Friedson.
Yes, first of all, thanks to my Fed colleagues for work on the Black-owned businesses initiative. Really proud to see that move forward, and really appreciate your leadership on that. Certainly a critical initiative. The girls sports initiative and participation, and congratulations to the champion. Really proud of that, and look forward to her taking on Dad one-on-one. I'll be there to watch and make sure I cheer her on specifically. So pleased to see that, certainly, and just glad that youth sports are back, in terms of how important it is for our children, and making sure that all of our children have access to it. And speaking of everyone have access to it, really pleased the special appropriation that Councilmember Navarro and I have moved forward, and with the co-sponsorship of Council President and Council Vice President, Councilmember Hucker, Reamer, Katz, Joando, Glass, and Rice, I think everybody, for opportunity zones related to biohealth facilities, making sure that as we move forward with our efforts to expedite biohealth, that we double down on our global leadership on these life-saving, life-altering, and world-changing technologies and innovation, that we're making sure that everybody in our community and every community in our county is benefiting from that and has access to it. And so really pleased to move that forward and appreciate your partnership on that, Councilmember Navarro. So pleased with that. It's chock full of goodness I will share, which is the virtual nudge we're getting from our good friend, Councilmember Rice, who we're pleased and thinking of that he's okay, and yield back to you, Mr. President.
Thank you. And just colleagues, I know we're back. We always want to speak to every item on the consent. Moving forward, we'll go back to the standard practice of, just kind of moving consent forward. But we've also got Council Members Katz, followed by Council Member Hooker.
First day back.
I know.
Thank you very much, Council President. I will be the briefest of all. Please add me to 5E as a co-sponsor.
Thank you. Council Member Hooker.
I wish I could prove him wrong. I just want to make sure, Madam
Your
Clerk,
mic.
out of practice. I wish I could prove him wrong, but I just want to make sure, Madam Clerk, I was added to D and E. Nice job.
All right, and virtually, Councilmember Rice has asked to be added as a co-sponsor as well, I believe.
He was already on E. I don't know what happened there. They got lost in translation. And
Okay.
I think there was another council member who was already on. I apologize for that. It just didn't get through.
Okay, and I'd like to be added too if I'm not officially. Great. Well, thank you, colleagues. There obviously is a lot here that is so important, and just to reiterate Council Vice President Glass's comments about our public health officers, and it's especially important for us to stand up with them. And as was noted, it has impacted the hiring process, and so we have to validate those comments. So with that, colleagues, all those in favor of the consent calendar as amended, please raise your hands. That is unanimous among all those present. And with that, we are adjourned for our lunch recess, and we will be back at 1:30 for our public hearings. Thank you.
Which is